The views and opinions expressed do not necessarily reflect those of Access Fort Wayne, the Allen County Public Library, or any other supporting groups. If you'd like to produce a show, call us at 260-421-1250.
Hi, I'm Dr. Rudy Cashman, neurosurgeon, Fort Wayne, Indiana, for 41 years, but I'm only 39 years old. I was with us tonight, Dr. Richard Johnson, who's going to share this show with me today, because he has a great interest in mindfulness. But let me give you a little bit of background where I'm coming from. I've been a neurosurgeon for 41 years, but I notice 75% of the patients that I'm looking at, Richard, need a coach. They just need coaching. And that's the purpose, really, of this show. And I've even put together the Mind-Body Index, about 25 illnesses that are caused by stress, that are caused by the mind. They don't need injections, they don't need narcotics, they don't need operations. But the question would be, Richard, well, how are we going to treat these people on the Mind-Body Index? And that's what this show today is, mindfulness, really is all about. And I'd like to ask you, Richard, I know you've had a lot of experience, and you visit with Kabat-Zinn, probably the most famous person there is, from Harvard University Mass Journal, who is a teacher of mindfulness in living. What is your definition of mindfulness?
Well, there's a lot of them, a lot of good ones, but the main thing is that we're paying attention to the moment on purpose, and we're doing it non-judgmentally. Or another word we could do is that we're bringing our mind and our heart together in the moment and living. And the on purpose part is important, because I'm not talking about spacing out. I'm talking about I'm here now, I'm talking with you now, I'm aware that I'm talking with you now, and I'm looking at my thoughts, I'm looking at how I'm doing that, I'm becoming aware of the process of communication, or whatever else I'm doing. And the problem for many of us is we're going along, things are okay, and then all of a sudden things don't feel quite so good, and we're going to be self-critical, we're going to be unhappy with ourselves, and we flip ourselves out of the mindful flow. Mindfulness is flowing with the moment, like many of us did as kids. You know, if we had a healthy childhood, as children, that's how life was. But as we got older and serious and became big deals and all that, we often have the habit of being mindless. We're letting thoughts come through and controlling us, instead of saying, here's a thought. I'm aware of my thought. I'm aware of my body. I'm aware of my emotions. I'm aware, and I'm cultivating that awareness. That's what mindfulness is.
It's very interesting. We really lead in our lives today pretty mindless lives, don't we?
We do.
We don't pay any attention to what we're doing. We don't pay any attention. And that's, I mean, the way I see the definition of what you're seeing in my own experience, in other words, we're paying attention in a particular way,
Yes.
In full awareness,
Yes.
on purpose.
Yes, yes, yes.
On purpose, but non-judgmentally.
Absolutely.
We're not judging the past or the future, just to look at the facts of something. Mm-hmm. It's really mirror thought, isn't
Yes.
it? Your thought is bouncing off the mirror, and you're paying no attention to the past or the future. And it's a great way, I think, to treat mind-body illnesses. Pain, for example. What's the core skill of mindfulness treatment really can be used for? Pain, just to look at the purity of pain, and not how it's related to our past or to our future or our job or what's going to do to us. And I found in the pain clinics, that I help run, which is a great deal of today, that this is a great way to treat pain. How do we treat pain in the medical community a lot today? Narcotics. I was running a big clinic in Van Wert today. I just came back, saw 10 patients, and many of them were on narcotics. I saw one young gentleman who, for low back pain, was on OxyContin, and many pain clinics, many injections, and he was incredulous when I reviewed his low back X-rays, which had been read by the radiologist with a 3-page report, were normal. He couldn't get over it. His wife was a nurse, and they couldn't get over that. I thought that they were normal. But why am I having this pain? And I think what he was a stressed out individual, heavy smoker, COPD at age 30, failing lungs at age 30, and smoking causes stress. It's not the cause of smoking. It causes stress. And then he developed, fibromyalgia and a back pain, and then he became addicted through pain centers and injections, and he had a list of medications, Richard, that was this long. It was this long. I looked at them, and I couldn't see how he could have gone from doctor to doctor. And I spoke to them a long time, and they seemed cooperative. They seemed understanding. I think probably because the wife was a nurse. And I don't know if they're going to do it, but I encourage them to pick up my DVD on smoking cessation, because she was coming to Fort Wayne tomorrow to have something done. Anyhow, maybe join the Y, start working out regularly, and to turn this around. But I also spoke to them about mindfulness a bit, to learn that, pick about tapes on that. Then we spoke about earlier, right, about mind-body illnesses, fibromyalgia, all types of rashes, headaches, atypical chest pain, all sorts of abdominal complaints.
Oh, yes.
Gershon wrote a book called The Gut, the Second Brain. He called the book The Second Brain, because how our mind, through the autonomic nervous system and through hormones, through neurotransmitters, affects our gut. We think our gut reacts. Now, and there's numerous illnesses, in the gut, from diarrhea to colitis and irritable bowel syndrome. 20 million people. Irritable bowel patients, teach them mindfulness would be a wonderful thing. They might be able to get away from their medication, and you can keep on going down this list. Atypical chest pain, the most common cause of chest pain is stress. And it's not just running off with an angiogram and an angioplasty. One I thought to think, is this a stress reaction? Sure. And many skin rashes are due to the mind affecting the body, and these would be great candidates for mindfulness teaching. I saw an executive recently who was getting a rash every 2 months because his business was failing, and he had an appointment to go to the Mayo Clinic. And I talked a little bit, and you could realize this is neurodermatitis. His mind was doing this to the body. He'd be a wonderful patient to teach mindfulness to and stress reduction as an alternative to medication, injections, and procedures. Anxiety, depression are great ones that can be treated this way. And just to get away from this automatic response in our lives, to become more mindful of what you're doing. Tell me, Richard, how do you discuss the difference between in a being mode and a doing mode, which is important in mindfulness?
It is. Well, we think often about doing as physically doing something, but the mind itself can be in either a doing mode or a being mode. The doing mode is that part of us that's constantly processing. Today I've got this doctor's appointment, then I've got to go over here to the bookstore and pick up a present. Did I bring the coupon that I was going to have? All those different things where our mind is racing about, like there's a room in our head, and it's going all which ways. And that is stressful. It is absolutely stressful.
And we have a list that long.
Yeah, right.
Of what we're going to do. Take the kid to the soccer game, let's pick him up at school.
Whatever it is.
And we just keep on racing, and you wonder why women have a much higher incidence of stress in their lives than men. It's almost 10 to 1.
Right.
Because they're constantly in this doing mode.
Right. And so, of course, we have to do things. There's no doubt about it. But we can act in the world from a different way of being, and that's the being mode of the mind. This is what one of the things about psychological sciences in the last 20 years, and of course the biological sciences, is that they're beginning to discover that mindfulness is a way of slowing down the process, even if I'm running, right? I'm slowing down the inner process of what I'm observing. So I can go into this being mode, and in the being mode, I'm here now. You know, the famous old book, Be Here Now, I'm here now. And so I don't have to worry about what's going to happen later. I don't have to have all those remembrances in the past, but it takes training. It takes training.
To become mindful.
Yeah, it is not automatic. Everybody can be mindful, but if we're not training ourselves to switch over, it's almost like there's a switch in the mind. And you've done it, right? One of the most common ways is breathing. Take 3 deep breaths. And very often we can switch from the doing mode of the mind to the being mode of the mind, as long as we've learned the discipline of moving out of the habit, because the habit of the doing mind becomes so powerful as we get older. Once we're past the childhood thing, then all of the pressures of life come up, and somewhere I read the average person has 20, 30, 40, 50,000 thoughts a day, and those thoughts come in and are stressful because somebody has not learned to be bigger than the thoughts. There's a lovely image that John Kabat-Zinn shared, and that image is, let's say stress is a teaspoon of salt, okay, and I put it in a glass of water, and you drink that glass of water, it's not going to be very pleasant because it's so salty. Yeah. Everything is so stressful. Everything is contained and stressed because it's all filled with that way. But take that same teaspoon of salt and put it in a lake. You take a drink, you don't taste it because the lake is the being mode. And that glass is the doing mode where I'm doing.
I got you. In other words, just to pay attention to exactly the very moment on purpose, not judgmental about anything, paying attention to while you're doing the dishes.
Yes.
And pay attention when you're doing the gardening, looking at the flowers, looking at every petal and the sunshine. And then, obviously, you don't worry about the past and the future, and it's very relaxing.
It is.
And in other words, we are constantly looking at mismatches in our lives, our expectations from what's going on, and that we become stressful, and all the stress in the end will head for our organs and cause chest pain and skin rashes and irritable bowel and headaches. And mindfulness is a great way to treat headaches.
Oh, absolutely.
I mean, versus taking all these medications. And when our mind wanders away from our awareness, isn't really the breath a good way to get back to it?
It's the very best. Research shows it, and we're always breathing.
Yeah,
right?
Pay attention to the whole breath.
Right, but you're gonna watch it just like if you're watching a movie, right? You're watching your breath. You're feeling the sensation of the diaphragm filling and then letting it go. And I say again and again, if you can do that, somebody's got a stressful job. You got to go to the restroom.
Yeah.
Go there and then breathe mindfully.
Take 2 or 3 minutes.
Yeah.
And consider a little space and time.
Yes.
I do that a lot because obviously I'm writing books and doing neurosurgery and doing all sorts of things and TV show one thing or another.
Right.
It could be very stressful, but I take these 3-minute moments in time where I don't think of the past, the future, what I'm going to do, have a cup of coffee, whatever, take some deep breaths, think of nothing, and it's very relaxing.
Right, and I noticed that when you came in, you had quite a, you said, you walked in and you, here tonight, you said you had quite a day, and then I saw you sit down and then
it was gone.
You were here.
You were right here.
I
was right here.
Yeah.
Fully aware of this.
And it wasn't my gosh, what's going to happen with this show? It was just like, boom.
Yeah.
That's from practice. That's discipline.
And you have to practice mindfulness to bring it to your life.
It's only real if we practice it.
Yeah. A good way to start really is to take some event every day and practice full mindfulness. Just a start. Isn't that a good way to start it?
A meal, a conversation. A lot of times in a conversation, somebody wants to get their point in, and they're thinking about that and not listening. In a conversation, when you're speaking, if I am mindful, I'm just gonna hear you speak. you know, and then I'm right here, right now. Whatever it is, consciously choose. This is what I want to do. When I'm driving, I'm going to be driving right here. I'm going to observe my own everything, and absolutely body sensations, but I can observe my thoughts. If I'm observing my thoughts, I'm in the being mode.
Yeah.
Because that's where I am. And you mentioned pain before. I had chronic back pain. What I learned to do with my back pain was to pay attention to it. It was giving me messages, and I didn't want them. I didn't want those messages.
Yeah.
And then
But you didn't decorate them.
That's right.
Yeah, you didn't decorate them.
That's
you looked
right.
at it as pure pain, and you didn't think about, I can't play tennis, I can't walk, or whatever. You just looked at the pain itself.
Felt the sensation. I said, oh, is this a
Yeah.
1 right now? Is this what is it? I was right there with that.
Yeah.
And you're right. I didn't go into the emotions.
Yeah.
I didn't go into the thought. If I did, I observed those and then brought myself right back to I'm paying attention to this back pain because it's something in me, you know?
Yeah. You accepted it.
Absolutely.
And didn't obsess about it. You didn't decorate it.
Acceptance is essential.
I know you spent some time with Kabat-Zinn from Harvard, a very famous person, and took his mindfulness course. How many days were you there?
I was with him for 7 days. This was in upstate New York and in Worcester. He's centered in Worcester.
Yeah.
And then another 9-day training. And then I had another 8-week training before. But I was with him for 7 of those days.
Tell us a little about it. What was a typical day?
In the training? Well, it's they don't mess around.
Yeah.
It starts at 6 in the morning, and we usually finished about 10 o'clock at night. I mean, we got to eat in there, but but we
mindfulness.
yes, that's right. That's absolutely right. And so it was the whole thing was that.
Yeah.
But we began meditating in the morning, a sitting meditation. Then we'd have conversations about it. Sometimes small groups, sometimes large. This is large. This is 200 people getting this training who were going all over the world.
Yeah.
Sweden, Germany, Austria.
Wow.
I had great conversations in German with some of my German colleagues. So we just, and then we did walking meditation. We did something, the body scan. I'll explain that. We did all these different practices and then had conversations about it. Ate, came back and did that. So it was a combination. There's always a focus on some kind of what we call formal practice. Formal practice is some kind of meditation or
that you might, by formal, you mean something that you would do at home, maybe on a daily basis, take 5 minutes and do some formal.
Or however long you're going to do it,
Yeah.
sitting, or you can stand. This body scan is a lying down meditation. You could have walking meditation. But what you're doing is you're consciously saying in this moment, I'm practicing this formally, and then the informal practice is the washing the dishes or whatever else.
Yeah.
And there's an interesting relationship between the two. When I'm doing the formal meditation, I seem to be building energy. I'm sort of the mindfulness energy. I'm getting more of that, and then it's easier to take it out in life if we don't take
the body scan seemed to be a big formal
It is.
teaching. But tell us about the body scan a little bit. In terms of mindfulness, what is that all about?
It's a wonderful practice. I only learned this one 2 years ago. I've been doing sitting meditation.
Start with
you lie down on the floor. It's easiest to lie down. You can actually sit or even stand, but usually lying down. And the object of it is to be totally in various parts of your body without distractions of thoughts or emotions. So that I'm lying there, and then I start with my left toes. Okay. And I'm bringing my mind into those toes, and I'm just there, and I'm breathing in and out of the toes, and the left foot, and then up the leg. And you can do that for 5 minutes, you can do it 10 minutes, you can do it 30 minutes. You do the whole process, and what you're doing is you're training yourself. This is the training. This is the mind training. You're training your mind to pay attention to the physical body, which is what we often neglect. We got this body, but we often get into our emotions or into our thoughts. So you're disciplining yourself to be there in that. And most people are going to go off to, I've got 2 hours, I got to do this, or when I left home today, I forgot to say this to my wife.
And I've heard if you do, your mind does leave you, you can bring it back with the breath.
You come right back with the breath.
With paying attention to your breath. It's the centering thing you do.
Or to that part of the body. I'm in my left wrist. and I'm just being there with that, with the sensations. Is it hot? Is it cold? Is it sore? Does it feel healthy? You know, what is it?
You use your senses, right?
Yeah, you're in your senses.
You're in your
And it's a
senses.
great training because our senses have a lot of information. Most of us are not aware of our bodies. Most of us have a body image that comes out from other people. You look good, you look bad.
Yeah.
But when you're in your body, it's not about other people's attitudes or thoughts or even your own.
Yeah.
You are completely present in the body, feeling the breath, feeling the physical body parts. It's a wonderful practice. It's very relaxing. And for example, a lot of people have trouble going to sleep.
Yeah.
They can do that going to sleep. But you could also do it in the day. And in the day, for example, if I'm taking a bath,
Yeah.
well, I'll just go through, if I got 10 minutes, I'll just go through my whole body and scan
You'll
it.
do a body scan while you're lying in a hot tub.
Yeah.
Man, that's got to be relaxing. The
It
hot tub's
is
so relaxing.
wonderful. It's
I mean,
wonderful.
That's really got to collapse you.
It is great.
And get the stresses out of your
Right.
body.
And you're just there. You know, there's nothing else in the world.
There. It may be raining on you if it's outside. Maybe snowing. I've always felt that if I get snow on me or rain on me, and I'm in the hot tub and practice the body scan, man, they do talk about relaxation.
Complete. It's complete.
You don't have to take a pill. You know.
I agree.
Yeah. What about walking meditation? Tell us about that a little bit.
The formal practice of walking meditation is that you can either go in a circle or in sort of a 10 paces one way, 10 the other way. And what you're doing is you're really slowing yourself down. You're picking up one leg, putting the heel down, and the toe.
And paying attention to each thing you're doing.
And everything you're doing, you're breathing with it, the breath, going back to your breath, and you're simply walking slowly. Then you pause at the end, then you turn around, and you walk back. If you have a distracting thought or emotion, just come right back. And for some people, this is good because there are people who are kind of antsy, you know, or times when they're antsy, and sitting or lying down just doesn't hack it. It's not the thing to do. Walking meditation is another option, and one of the most relaxing things in life, if we're present in the walking, is walking.
Yeah. You know, it's interesting. I was at my clinic in Van Bert today. I saw one, since birth, impaired child who must be, 25 now, was with grandma on one side and mother on the other. And this young girl was really tremulous, seeing me about a back problem. MRI was normal, had nothing to do with it. And I did refer him to the Mind Body Institute, and I thought and largely I sent her there because she was seriously overweight. But I could see now that for her, she was literally shaking like this, how wonderful mindfulness would be for her. That's the answer.
Oh, yes.
But a holistic approach of weight loss, mindfulness, I think would be tremendous versus, medication.
Yes, I agree with you on that.
And talk a little bit about reactivity and pain and stress. Tell us about that a little bit.
Well, the stress reaction is really the opposite of being mindful. So I can really sort of look at two sides of life. And because when I'm mindful, I'm responding to life.
Yeah.
When I'm stressed, I'm reacting against. I'm basically resisting life. You mentioned that mindfulness is kind of like a mirror.
Yeah.
Well, when I'm stressed, the mirror is broken. I don't really get what's going on, and I'm trying to get away from the way things are.
Yeah.
Well, they are that way,
Yeah.
and so at that resisting the way things are, I perceive there's something wrong. It's a perception. Life is life, okay?
Right.
I can perceive my back pain as something wrong, or I can just perceive it as back pain. So I react against it, and in that moment of perceived threat, I'm perceiving a threat to my life or to my identity. There's something going on. I was driving today, and somebody, in the last minute, whipped right out in front of me.
Yeah.
And in that moment, I was mad because I thought he was going to hit me.
Yeah.
And then for about 30 seconds, I was reacting. I wasn't yelling, but I thought about it because I felt a threat. Then I became mindful. But that threat to my life, the threat to my identity, then will lead me into fight, flight, or flee. And those things are pervading life. I mean, people are constantly reacting against the weather, against all kinds of things. And when we are in the reactive mode, we're creating stress in our body. And so when we are able to stop that for a moment,
become more mindful,
then we can respond. It's the same situation, but am I responding or am I reacting? And as you know, as a medical doctor, we have all these stress hormones, we have cortisol, we have everything going through us. Our immune system shuts down. And all of that's necessary for an acute situation. The tiger in the jungle, I got to get back to my Land Rover. That's a good idea. But if my life, I begin to react against my life, then what happens is my immune system's not working right. My gut's not working right. All of those, I mean, I don't know what percentage, but I've heard 60, 70, 80, 90% of illness is stress related. It might be 100, but a lot of it's related. And then, of course, once somebody's sick, they've got more stress. So it's that stepping back and saying, I can watch myself be stressed. I watched myself get mad at that guy who he peeled out, and he actually, his car started going back and forth because he was losing control of his own car. At a certain point, that's just life. You're going to get on a road, there's going to be some people
driving. Some things you cannot do. That's a beautiful example, really, of this reactivity. Yesterday, I had a very busy day running to trying to get out of town tomorrow, and I come back to the office, see a couple of patients between surgeries, and I get dictation to do, and that's a phone call from the IRS. I call the lady up. She's very nice on the phone, very nice. But telling me about a form that you had wanted signed that hadn't, the people who I thought were going to do it, she claims didn't do it. But then I go back to the secretary of the Mind Body Institute. Sure enough, it had been sent to her. We even got the return thing stating they had received it. And I said, well, did you let you know how upset you caused the doctor to be? It was really, I was upset a lot of the night over it because those kind of things, are threatening. But, she answered it mindfully. I was so proud of her. She says, no. I said, thank you. I'm glad you received a notice and didn't bring it up at all. That's being mindful.
Yes.
That's being mindful.
Yes, yes.
Instead of she could have gotten, into this resistance like I reacted to it. I thought that was really great.
And think about companies, about families. Whenever we are more mindful, if I'm not in my mindful self and my wife looks at me a certain way, I say, oops, and then she helps me be mindful, and I can help her. Then you've got a mindful relationship, and that really helps.
Yeah, especially, I notice at home, not listening to the person's conversation.
Oh, yeah.
Mindfully, I think that's a big one. Tell us a little bit, Dr. Johnson, about MBSR that you know quite a bit about.
It's mindfulness-based stress reduction, and that's the training I had with John Kabat-Zinn.
Yeah, that's a distinct course, a certain number of lectures.
Yeah, right. We take. It's an 8-week course. Yeah. We have before the course we have an orientation, which is free, and people don't have to take it, but they come to the orientation. And then we have 8 2.5-hour sessions. And then after the 6th session, we have a day-long retreat. And we teach formal meditation, the sitting meditation, the walking, standing. We teach yoga or Tai Chi or sometimes both. So we're talking about moving meditation because we've got to be able to be mindful when we're moving. And then we teach about the stress reactivity. We teach about mindful communications. So we're teaching a number of things, and every class has practice. Every class, because this is not theoretical.
It's something that works. Yeah. And something you're going to teach at our Mind Body Institute. Mind Body Institute, a very effective way to get around all these tranquilizers and narcotics and pain medication, and get the stress reduced mindfully. Something that, in the end, a person can do at home.
Yes, to train train our own minds. This is the most powerful tool we have. Yeah. And running to a doctor and not using your own mind is not going to help us. Of course, there's that a medical profession can be helpful, but it's, am I going there as a conscious patient? Am I being aware? Am I knowing what's going on? Am I asking the right questions? If I'm mindful, I'm going to get more out of the visit, and and I might say, well, actually, maybe I don't want meds right now. Maybe that's not what I want to do.
And that's why you can understand. My opening question to patients generally is not, where do you hurt? Unless they fell out on an airplane or get hit by a train, my opening words are, what's going on in your life?
I love that question.
Isn't that great?
That question. Yeah.
Oh. And anymore, when I see patients, I give them a yellow pad and a pencil before I see them. They're waiting for me for a few minutes, hopefully not an hour. I have them write out the history, and the diagnosis many times is right there on those yellow pages.
And it's helping them be mindful.
And helping to be mindful. And I found that mindfulness teaching is also helpful in depression.
Absolutely.
You know, cognitive therapy, talking to the patient is important. Certainly medication, very important. But the problem is 80% of people who've had one serious depression will have another one.
Yes.
And so they should try all modalities, from medication to cognitive therapy to mindfulness teaching, stress
and I want to
reduction.
talk about the research on that, if I could mention that.
Please.
Some of the best research that's been done on mindfulness was done by Mark Williams and Teasdale and Siegel and Kabat-Zinn.
Yeah.
And what they did a study on several sites in Canada and the UK and the United States, and villages and big cities.
Yeah.
They did on people who had clinical depression that had 3 episodes.
Yeah.
So these are people who have a very high probability of increased number of episodes of chronic depression, serious issues. In that study, using mindfulness and cognitive work, they found that a 50% reduction in the recurrence of serious depressive episodes.
I mean, that's
50%.
That is impressive.
And that's why in the UK now, as a part of the National Health Plan, they are mandating over the X number of years, the certain number of years, that will be everywhere because it works.
And it's cheaper. And it's safe.
Absolutely.
Something you can do at home. Used to speak a little more about depression. I mean, what is depression? A disorder of mood. Disorder of mood. Most of us have a touch of it. Matter of fact, when patients fill out the forms to see me about backaches, headaches, one thing or another, I don't hardly see a patient that doesn't check depression and anxiety.
Right.
It's just unbelievable. It's how common it is. And a lack of concentration, it's characterized with depression many times. Lack of energy, you get tired, don't want to get out of bed. That's a sign of depression. Negative thinking all the time. Always looking at the negative side of things. I mean, sometimes I wonder when I was in the doctor's lounge, they're watching all those nasty news coming on.
Oh, yeah.
And my father spent his lifetime reading the New York Daily News, nothing but negative news.
I know.
It affects the mind.
Oh, it does.
You start negative thinking. It's a form of depression. And of course, there's increased suicidal risk. And if it gets serious, you have to watch out for that. And that's the reason, especially, we see it in teenagers, these suicides. Sometimes the whole thing gets missed altogether. Some people feel totally hopeless. And sometimes, there's almost reasons for it. What about the practice of mindfulness, say, in everyday living, Dr. Johnson? How can one make it part of your life? How would you do that?
Well, there's a whole lot of strategies for that. But one of the things for me is that I will decide in a given week or a given day, today I'm really going to focus my mindfulness in how I'm with my kids. Today I'm really going to I'm going to wash these dishes, and I'm not going to worry about when it's going to get done, or I'm just going to be with these dishes. And I'm going to enjoy it. I'm just going to be here in this moment. It's like I feel like I'm winning different parts of my life to mindfulness. For example, exercise. Oh, I love to exercise daily, usually in the elliptical trainer or swimming, or I'm doing bike training now because I'm going to get out and bike. And in that process, I say I'm giving myself in this moment to just feel my sensations. And more of my exercise, I am absolutely high. As I'm doing it, and it lasts for a while because
you must secrete your own endorphins.
I do, and anytime
your own morphine.
And when we're mindful, I'm sure we do any kind of mindful. So it's like, here's my life, and I do plenty of stuff that's mindless. But I can begin to have more and more islands of mindfulness. And then the other thing I think is real important is to get the body feedback when I'm mindless. When I'm beginning to feel angry or sad, when I'm beginning to react against what my wife or somebody's saying, I say, feedback, okay, bingo, breathe. Be conscious of breathing. So I'm finding areas that really work for me to be more mindful. For example, driving. I used to be a pretty reactive driver. It's rare that I am now. It happens, but it's rare because I'm not worrying about, for tonight's session, I realized I was going to be a little late. I called somebody and said, I'm going to be 10 minutes late. Then I just went back to the driving. So it's it's a process of making sure that I'm paying attention to the feedback of my own body. And when I do that, okay, my shoulder, if I'm beginning to, my shoulders start going up. That's for me.
Yeah.
Drop my shoulders.
Relax.
So it's one of those things where I'm observing myself and my am I responding, am I reacting?
Yeah.
One of the key words for me is flow. Am I in the flow now of my life?
You know, Rich, I'm thinking, I didn't even read this, and I just thought of this just now. Wouldn't it be great if we all had one word?
Yes.
Like flow,
Yeah.
or the breath.
Yeah.
And that's when we see our mind wandering into our concerns, when we're trying to be mindful, just say flow or breath to pull us back.
Whatever
you have a
pulls back.
trigger word, and
That's
after a while, that trigger word could become automatic.
That's the main thing, because everybody can be mindful, but when you forget, when you go mindless, what's going to bring you back?
Yeah, it's not going to occur like that. It's something you got to practice.
Yes,
It's
practice.
like practicing my tennis to become a
Absolutely.
mindful person.
Absolutely.
I mean, really. And it wouldn't be neat, at least to start, at least take one meal a day
Oh, yes.
to start right away, tomorrow. Tonight, if you're going to eat, like me, going to eat later, I think we're going to eat at a restaurant after this. I'm going to be mindful, really mindful of every food that I'm going to eat.
And we taste it more. We get more of it.
Use our senses to taste it, to smell it, to touch it, to look at the walnuts, to look at the spinach leaf. Really be mindful of it. I think it's a great habit, and at least practice it one time a day, and we'll eat better for one thing, because we will know what we're putting down. A piece of fat appears, we'll be aware of it, and might push it over and eat a salad, and to pick one other event during the day that you might be mindful.
I love
so now
that.
you're up to 2, and you do that for a few weeks, and then slowly increase it, and really become a mindful person. You'll be taking a lot less medication. Probably have a lot less operations, injections, and won't even think about taking narcotics unless you break your leg. And what we're trying to do is avoid reacting automatically.
Yes.
Otherwise, someone angers us, or someone driving makes us mad, and we don't. We just, it's part of the traffic. It's part of humanity.
Pilot.
As long as they don't hit us, what does it matter?
Right.
What does it matter?
Right.
It's going to happen again someday, and just to accept it. I mean, many of us lead really mindless lives, don't we? Pay no attention. We're so darn busy.
I've been thinking about that. Somebody asked me the question, why are we so mindless?
Yeah.
And I'm not positive. I have two answers. One of them is it's a habit.
Yeah.
Habits are powerful.
Yeah.
You do something over and over again. Basically, we're practicing being mindless, in our lives.
You get a point.
So I think that's real. And the other thing is that this is a psychological explanation. I don't know if it's true, but there's a part of us that's warm and open and loving with the world, and there's a part of us that draws back.
Yeah.
In psychological terms, the part of us that draws back is the ego. And what one of the writers I read recently said, the ego doesn't want us to be mindful. The ego doesn't want to move into the flow because there's a feeling I'm losing control. Well, mindlessness is no real control, but what it means is I'm kind of walling out the world. The problem with walling out the world is it brings the stress reactivity, but there is some kind of illusion of control that some people say is why are so many of us mindless? Well, one reason is we have undisciplined minds. But why is it so hard for many of us? I mean, do a test with yourself. Spend 1 minute just focused on breath. Most people can't do that. The question is, why not?
Yeah.
And so it may be that there's a part of us that's resisting. And in any case, it is very important that we change from the habit of mindlessness to the discipline of being mindful in the moment.
It's really learned helplessness, isn't it?
I agree with that.
It's really learned helplessness.
And helplessness would be connected with depression, and helplessness is, if I feel helpless, I'm going to react. You say something to me, and I feel helpless, I'm going to react against you, or my wife, or my kids, or whatever, or my
grab
job.
that cigarette, or take that narcotic to try to feel better.
I agree with that. Yeah.
Really, we're learning to live in the role of negativity, isn't it? Really.
Yes, and that's so common in depression.
Yeah.
The whole thoughts of negativity, they're getting a spiral of negativity. and emotions and thoughts reinforce each other in a negative way, what AA calls stinking thinking.
And this really leads to, I've spoken before quite a bit about placebo,
Yes.
which can be a pill. You believe it? It works.
Right.
It can be a doctor.
Yes.
If the patient figures out that the doctor really cares about me, the doctor can heal the patient. Believe me, I've done it many times because I really care about the patient. I mean, and they figure it out pretty soon. But you can go do the opposite too. When the patients come out to see you and you didn't find out their background, you didn't say what's going on in your life, a lot of negativity going on, and then you can lead them to what I call the nocebo. Richard, I met hardly anybody who ever knew what the word means. I wrote a book on it, Nocebo, the Evil Twin. I think it's very interesting to read how we use negative speak to convince people there's something wrong with them, like an MRI is abnormal and is causing their pain where maybe it's not. Or an angiogram is causing their heart pain and maybe it's not. So the nocebo effect is used a great deal in medicine. Pain clinics, they use it a lot. Because they changes, everybody's got an abnormal MRI for Pete's sake except little children. And you can convince people this is the cause of your headache and let's operate on it or stick needles in it or give you a narcotic over it. And you're much more likely to accept it because you're in a negative mode.
Right.
You're in a stressed mode.
Right.
And that's what most of these people who fall for this stuff are stressed out individuals. And the problem that they're treating, sticking needles in the spine, maybe sometimes operating on it, and giving them narcotics because of this negative reactivity, and it's real easy to mislead them through the nocebo effect. If they were more mindful of their condition, more open-minded, less rigid, they wouldn't fall for that stuff.
That's right. And then they nocebo themselves, don't they? Because they keep repeating it.
Oh yeah. The providers can use do the procedure, and you believe the placebo effect, and they're better for a while. About 2 months go by, and then they become reactive again, start searching for another doctor, another part of the body, and the merry-go-round starts from the placebo to the nocebo. They get nocebo to the procedure, and they get placeboed by belief. They feel better, but 2 months later, placebo's gone. Now they're often running again. Something very important, I think, for people to know about, because when you are told this study is related to your condition, your blood sugar is 800, heck, you're diabetic. But because your MRI is abnormal or a CT, unless it shows a big old tumor or a big old ruptured disc, just little bulges and things, may not be related to your symptoms. So you have to be really open-minded and be mindful what's going on and create new possibilities, not be so rigid and go into drinking and smoking and alcohol, try to relieve, your problems. And as we grow older, I think mindfulness plays even a bigger part. We think that the aging process leads to nothing but death and nothing useful, and we have no purpose. So to become more mindful of the part of life you're living in and to develop a purpose in life, for example, I think is extremely important in the aging process. So
Yes.
mindful,
Yes.
to do mindful aging is important.
Yes.
We need a purpose. We need to exercise. We need to work out regularly to become mindful of our condition and get rid of this negativity that exists in many people that we see today. Put some demands on yourself. I have on my webpage, Cash for Mind Body webpage, I have down there Rudy's Brain Gym. I think it's pretty good to look at that because I've listed there the 20 longevity markers that a person can look at, how to live to be 100 and be mindful of what they're doing, mindful of what they're eating, mindful of their muscle mass and activities that they're doing, and to avoid dementia. A lot of dementia is caused by eating the wrong food. People don't realize that. And to be mindful of food, they're putting down. And I think the biggest thing, getting a day older, be mindful to get a purpose in your life. That, I think, is the number one marker of proper aging.
I agree.
Rick Warren wrote a book, The Purposeful Life. At first I thought, geez, I don't know.
I read it. I liked it.
At first time I threw, I didn't like it. I thought, God picked me. Why would God pick me? But when you read it again, and you realize that purpose, he hit the nail right on the head.
He did.
He hit a big nail on the head, and I think it's a wonderful book to read. We all need a purpose. I feel I got a purpose. I'm lucky.
Yes.
And I said, well, Richard, you got a purpose.
Yes.
You know, you like mindfulness teaching, and you have a purpose in life. And I always tell people not to live into the role of old age. You know, become mindful of stay as young as you can. There's a little bit of aging goes on in all of us. It's not very much. It's not because we withdraw from life and become mindless and withdraw from life. A lot of significant people age a lot quicker.
Mindfulness keeps us in life.
In life.
And when we remind us, we're actually not even in life.
Yeah, you're not even in life. Tell us a little bit about mindfulness on the job. Can a person practice mindfulness on their job?
Absolutely. Well, first of all, it's very helpful if we've picked a profession or what we're going to do that fits our purpose. If somebody's ought to be a teacher and is over here working in construction, that's going to be a problem. But so I think the most important thing, connecting with what you're saying, is have a purpose-driven life, and that my job is a part of that. That I can really sense that that's a part of why what's going on with life. There's a reason why I'm doing this, and I think that if we are mindful, then I'm teaching, I'm doing construction, I'm collecting garbage. I don't care what it is, and I'm completely there in that job, whatever it is.
You know, a great example was at Lutheran Hospital. They had this Mexican gentleman, and every day I walk in, he's doing the floor. Hi, Dr. Rudy, and I would say, Jose, boy, the floors look really great. And he took such pride in it every day, smiling on his face. How's it looking, doctor? He was mindful of his job. It doesn't matter what you do.
No, it doesn't.
Does it really?
Am I in it? Am I in the job?
Exactly. It doesn't matter whether you're a brain surgeon or you clean the floor. Just be the best at it and be proud, you know, of what you do. I think that's a good way to avoid burnout of your job. I don't care what it is. You're working in a factory. Pay attention. I mean, if you're making cars, look at the beauty of them. Look exactly what you're doing with them. Look at the end product.
And the service that I'm providing.
And the service that I'm providing. And how are the sales? Get involved with the company. Don't just be the mindless individual working there. And there's the company. There's me. This attitude needs to be stopped. I think if we all identify each other together, be mindful of each other, the company's going to make a profit to pay my wages. So why not be mindful of trying for them to have a big profit so I continue to get paid?
Right.
I'll be honest with you, I feel extremely lucky because the easiest way to become mindful and have a purpose, feel good, is to help people.
Yeah. You love your job.
You know, I love my job. And if that's not your job, then get an extra job where you're helping people. When you help people, the payback is huge.
It is. It's a circle.
I feel days the payback to me is a lot bigger than the payout that I'm giving.
It always is.
You know, people are more grateful. In my experience as a physician, I think people are more grateful than I deserve many a day.
Well, whether that's the case or not, gratitude. You were asking before about mindfulness.
Yeah.
When I'm being grateful, like when I wake up in the morning, oh my gosh, it's another day. I'm having another day. I spend a little time remembering my dreams if I can, and then I start with what are 3 things I'm grateful for.
Yeah.
What am I grateful for? And then in the course of the day, I often stop. I'm grateful for this. I'm grateful. Gratitude brings me into the moment.
Yeah, isn't it great before you go to bed? I've read this before. Norman Vincent Peale's works. You won't believe this. I had a patient who I cured his wife of something. Nothing that difficult, but she has had a lot of trouble though, and he was so grateful. He was the assistant minister to Norman Vincent Peale, who wrote all those great books. And the next day he walks in, brings me 21 books on Norman Vincent Peale, signed by Dr. Peale and his wife Ruth.
Oh my gosh.
God did it. Unbelievable. He said, you know, doctor, I read the stuff on the wall in your office. I know you would read it. I'm 87. I'll not read it again. I don't know why he said that, because he was perfectly capable of reading. He was a minister. But he said, I know you would read it. I've read them 3 times. I mean, what wonderful. And he looked at the positive side of things.
Yes.
You know, Norman Vincent Peale walked out one day. It was snowing. It was raining. Well, for me, with that the last couple of weeks, it was in Chicago going to give a talk. And this a black gentleman young man driving a limo to take him to the convention center, walked out. Isn't this God most awful beautiful day? It's how you look at things. So how mindful you are.
Yes.
And after that, instead of all the snow and the rain and sleet, Dr. Pierre decided, it's a beautiful day. And he's used that ever since.
Great.
And so have I. And
It's
a very
wonderful. I agree.
instinct. You know, the trick is, and I think personally I've done it, and I think you've done it, to blur the line between work and play.
I think that's so
You know,
important.
if you can blur that line between working and play, like even in the hospital, I used to have this nurse, 6'4", black gentleman with long hair, dreadlocks hair, and he had the softest voice. And we would make rounds together, and we always said hello to everybody in the elevator, walking down the hall. And when he left, I frankly cried.
Yeah.
I mean, the whole hospital loved us.
Oh, yeah.
I mean, I thought people like me, they liked him better because he was so kind, so thoughtful. He projected mindfulness. He was mindful of that person.
Yes.
It was the gentleness, and
I want to add
really,
to that
yeah.
one of the signs of whether we're being playful in our job or whatever in our life is, are we smiling? I don't mean smiling
Yeah.
every moment,
Yeah.
but I mean, you know that physiologically
Yeah.
when you smile, releases endorphins.
Absolutely.
And one of the things if I've gone too long without smiling or laughing,
Yeah.
something's going on here. I'm
Yeah.
not really in this moment. I'm not really here.
Yeah, I think it's a wonderful habit. As a matter of fact, this morning I went to Marion, Indiana, to start perhaps a wellness center in the Y. And the reason I got there because I had a patient, Reggie Nevels, who's on the board of the Y and on the city council. He has a smile that's a killer, just a killer. When I see him, all I see is this big smile. And he had it again today. And it just makes you jealous almost to smile like that, because talking to him, how could you possibly not be mindful of him, you know, or think a negative thought? And mindfulness has such huge benefits in health. 75% of the people that see a physician today have a mind-body illness.
Absolutely.
All they need is someone to say, and what's going on in your life, and work at that aspect of it.
Yes.
And they're presenting as their stress, their subconscious stress that's added up, is now attacking one of their organs through neuropeptides and neurohormones and neurotransmitters.
Yes.
And how are you going to relieve that? Is you have to deal with the stress.
And we have to change our
have
minds.
to change our minds. Unfortunately, medicine a lot of times treats the peripheral body and forgets that this really is up there. Let's talk a little bit about, I know we've spoken quite a bit about this before, about Arrow 1 and Arrow 2 and pain. That's one of my favorite subjects. And we know how to get people over their pain problems through mindfulness teaching. Tell us your interpretation of it, and then I'll tell you mine.
Sure. Well, arrow 1 is if an arrow, I'm shot from the arrow and it hits my arm. Okay, that hurts.
Yeah.
And that's pain right there. Okay, and that's very clear, and it can be treated, whatever.
Yeah.
Okay, that's arrow 1. But the bigger arrow is arrow 2, because arrow 2 is our feelings and our thoughts about this. Oh my gosh, I'm never going to be able to play ball again.
Yeah.
Oh my gosh, I'm going to die. Oh my gosh, I'm going to lose my job.
Yeah.
Oh my gosh, I'm going to lose my house. I begin to load onto that depression, hopelessness,
Yeah.
anger, sadness, and that arrow's that big and this arrow's this big. Pain's pain.
You're decorating the pain.
Yeah, I like that. So
Yeah.
it's making it completely different. It's blowing it way out of proportion. Remember, mindfulness, on the other hand, is looking and becoming a mirror of that physical pain. Okay, it
Yeah.
hurts. I need to do this and that. When I'm mindless, all of a sudden, all of those thoughts and feelings take off, and I'm gone. You know, I'm someplace else, and I'm not. How much am I even aware of this pain? It's all of these scenarios that I run, worrying about the future,
Yeah.
and that is much bigger. And that's one of the studies that I read. People could reduce their chronic pain by 2/3 by mindfulness, because they were reducing second arrow. They were bringing
huge arrow 2.
They're bringing
their
the feeling,
hopelessness, their anger,
all of that down, and then often And this is interesting too. When I was up in Toronto talking with
Yeah.
Jackie Gardner-Nix, one of the experts on the issue of chronic pain and mindfulness, she said, actually, the sensations of pain were less because, as we know, the sensations of the physical pain are going into the midbrain,
Yeah.
and the thoughts and the feelings are going to the midbrain, and the midbrain doesn't care whether
Yeah.
that's a thought or a feeling,
Yeah.
because to the brain it's the same thing. And so I'm ramping up, or decorating, as you say,
Yeah.
the physical pain with all the emotions and all the thoughts.
Yeah. The arrow 1, the acute pain, you get a broken leg, impulse goes to the brain. You set a cast, you give narcotics, and that's part of this I'm going to bring up here a little bit because there's so much of it in this country. But we give the narcotics for 6 weeks. There's an end point.
It's acute. It's
acute pain, 10% of the pain problems. The big problem in this nation is the chronic pain problems. And Richard, it's not little, it's huge, huge. Again, talked to a medical student today, helped me in an operation. He's visiting here for 6 months, who part of his rotations was to be part of a general practice. He was an osteopath for 2 months at 2 different practices. They spend 60 to 70% of the time in those practices refilling narcotic prescriptions. And the pain was not because they've broken a leg, it's because it's chronic pain. I mean, what is chronic pain? Let's talk about chronic pain. That's pain more than 6 months, and we have neuropathic, that's part of chronic pain. That can be shark takes off your leg, the nerve is cut in half, and the nerve impulses, that's a neuropathic pain. Trigeminal neuralgia, ruptured disc, neuropathic pain. You can use narcotics on that, and that's arrow, that's chronic pain, okay? And you have an emotional reaction to it because you have it all the time. And you can give narcotics for a short period of time for them, and they indicate, now if you have neuropathic pain, it's cancer, give it for a lifetime, not a problem. But even for them, if it's a cancer for 3, 4, 5 years, there is a problem because the drugs start working, and you increase them and you increase them. It's been shown in pharmacological research, and you won't only believe this, narcotics only help 30% of the people 30% of the time. Why would you give them for an
That's
extended period of
9%.
time?
That's 9%.
9%. That's the reason I see so many people back. They get 4 different narcotics. I had one come from Kansas City the other day. She made cheese on OxyContin and Percocet, and just one drug after another. And I said, do they work? No. She came here because she wanted an operation. They don't work because they stop working. They change the circuitry of your brain, and they don't work. And many of them don't just become habituated, they become addicted. Pain books will say addiction is rare. I say baloney to that. Many of them are addicted because they have overwhelming craving. They have overwhelming craving, and they want that high, they want that dopamine. And if you try suggesting that they consider reducing them or stopping them, you might as well hit your head against the wall. They're not going to do that.
Look for another doc. Yeah.
No way. Yeah. And then we have nociceptive pain, which is bursitis, tendonitis, and that is another 10%. Mm-hmm. But then we have 50% of the pain problems which have metabolic pain.
Yes.
They say, I hurt. We don't know why they hurt. We have no living idea why they hurt. These people could be very well treated with mindfulness teaching.
Absolutely.
Because they have anxiety, fear, stress. That problem is not in their spine. They stick needles in their spine, but the problem is in the psychiatry and neurochemistry of the brain. The pain is real.
Yes.
So let's summarize here a little bit in this very interesting discussion. That mindfulness teaching, number one, is doesn't cost a lot. Number two, it doesn't hurt anybody. It helps a lot of people. Don't need to buy a lot of medicine because we don't give any medicine. And it's extremely effective against these mind-body illnesses and chronic pain. And thank you, Richard, so much for participating in this. I can see that you're extremely mindful, extremely knowledgeable, and we look forward to you teaching it at a Mind-Body Institute. And you've certainly increased my knowledge, and I hope we've increased your knowledge. Namaste. Thank you for watching us. Look forward to some of our other DVDs. too. I thought I had 20 minutes. I didn't start this on time. And
I heard him rustle over the night, but
Yeah.
because of this angle,
Yeah.
I couldn't quite see it. I thought, that can't be. He must have
yeah,
dropped something.
yeah, I thought we had 15 minutes, and I didn't start this on time.
I thought something was up there, just looking over.
Yeah, yeah. Very nice, Richard. I think people know what mindfulness is now.